So some general precautions for using chemicals. This is all redundant. We've had this before, but it's good to, again, go back over it. Always wear your PPE. At the very least, you should wear some kind of gown that helps to protect your skin from the embalming fluids, but also protects clothes from staining, from dye. Always wear gloves. Again, you want to wear nitrile gloves on the inside, and then latex gloves on the outside. That's going to help you avoid any parenteral injury. You want to wash your gloves frequently. Again, latex will break down very quickly. And you don't want to get formaldehyde on your skin because that can cause drying of the skin, cracking of the skin, and skin that is cracked is going to be a lot more susceptible to infection. And it can also technically cause an inflammatory response in your skin too. So always wear gloves and some kind of eye protection. Formaldehyde especially is very irritating to the eyes. It is a lacrimator. If you do get anything in your eye, again, you want to flush that out with cold water. So eye protection is pretty important. If you do get any formaldehyde on your skin, you'd want to, again, flush that out with cold water. And you always want to use your ventilation. You want to turn that on almost instantaneously when you first walk into the prep room. That's going to help you avoid exposure to fumes. Again, your ventilation should be 12 to 20 air changes per hour. If you do have any spills of formaldehyde containing solutions, then you want to dilute that with cold water or ammonia. Again, the ammonia will neutralize the formaldehyde, and cold water will help to cut down on fuming. You should have some SDS sheets in the prep room. Those are nice to have in the prep room. Again, should not be the only place that you keep your SDS sheets. They should be in a common area where all employees can get to them, but it's a good idea to have some in the prep room. When you're done using bottles, then you want to flush them out with water. You want to then put the cap back on them to recap any bottles that you're not using. Dispose of them in the biohazard container, but before you dispose of them, again, always flush them out with water. Again, keep the machine and bottles capped at all times. If you're not pouring fluid into the machine, lid should be on it. If you're not pouring anything out of a bottle, cap should be on it. Helps cut down on fuming and also is going to avoid any spills. Remove all traces of formaldehyde prior to using disinfectants. You want to make sure that there's no formaldehyde around because formaldehyde could neutralize things such as benzalkonium chloride. And I want that disinfectant to be working as a disinfectant. I don't want it neutralized. Then pour embalming fluids into a tank of water. Now, that does not mean that the tank is completely full, but there should be water in the tank before you pour embalming fluids into it. A half gallon is just fine. That's going to help to cut down on aerosolization and vapors. It's also going to help cut down on splashing. Okay, so first we're going to look at arterial fluids. The arterial fluids are the fluids that have your preservative in them. They have an index. So there's two ways to classify arterial fluids. You could classify them by index. We've seen this before. Low index fluids are 10 to 18. Medium index fluids are 19 to 27, and high index fluids are 28 and above. Now remember, the high index fluids are for quote-unquote difficult cases. You should not use high index fluids on normal or dehydrated cases. They tend to be buffered to be a little bit more acidic than normal, so they work faster and they fixate tissue better, but the problem is they work faster. If they work too fast, they can wall off the capillaries. They'll sear them and you won't get any diffusion. So stay away from high index fluids on cases that are not difficult. We can also classify arterial fluids by cosmetic application. So a cosmetic arterial fluid would contain an active dye. Active dyes will dye tissue, will color tissue. Or there's non-cosmetic arterial fluids. These would be fluids that contain very little or no active dye. They may even contain an inactive dye. So again, an inactive dye would not color the tissue, it only colors the fluid. Now, when we talk arterial fluids, dilution is a very important aspect of that. There are technically two types of dilution. There's primary dilution and secondary dilution, and we've talked about both before. Primary or initial dilution is the dilution of the arterial fluid as it is mixed in the machine. So it's the dilution that happens when you put arterial fluid in the tank and then add water to it. The technical definition of primary dilution is a little convoluted, but it is the amount of fluid that at a certain index, by adding it to a certain amount of water, will give 1 gallon of solution at a certain index. So these are what we call primary dilution problems. Primary dilution problems are always mixed for 1 gallon. It's much like in lab when I said, it's easier math if you just solve it for a gallon. That's basically a primary dilution problem. Okay, it's always for a gallon. Now, the recommended primary dilution for most bodies would be a 2 index. So 2%, same thing. That's for quote unquote normal cases or even dehydrated cases. You should never go below 2. Difficult cases would go above 2. So edematous or decomposing bodies or bodies that have been dead for a while or jaundice cases, those would all go above 2. So 2 is always your starting point and you never go below that. Secondary dilution is the weakening of the arterial solution by the body's fluids. So that blood, lymph, interstitial fluid, edema, etc. Normally, a normal body is about 75% water. Dehydrated cases can get as low as 60% water, and edematous cases can get up to about 80% water. So it's that extra fluid in the body that when you pump in your arterial solution is going to weaken it, and that's why we never go below 2. Because if you pump a 2 index solution into a body, it's not going to be 2 once it gets in and starts mixing with all the fluids of the body. It's going to be lower. And so you have to make sure that for like edematous cases, you have to go high index because you understand there's going to be a lot more secondary dilution. So now we're going to look at primary dilution problems. So this is what a primary dilution problem would look like. It only gives you 2 pieces of information. It only gives you indexes. What would be the recommended primary 3% dilution of a 20 index chemical used to embalm an edematous body? Again, so what it's asking is how much of a 20 index fluid would I need to make 1 gallon of 3 index solution? That's basically what it's asking you. So we just use our regular equation. C1 times V1 equals C2 times V2. Plug in the numbers. C1 is 20. V1, we don't know. That's what we're trying to figure out. C2 is 3. And V1 is 128 because it's a gallon. Primary dilution problems always have gallons in them. So if we isolate V1, we'd get 3 times 128 divided by 20. And that answer comes out to be 19 ounces. Now, in a primary dilution problem, this is not the end. Again, you'll know primary dilution problems because their answers are amount of fluid and amount of water. So to calculate the amount of water that you would add to the chemical, you take V2 minus V1. So 128 minus 19. And you come up with 109 ounces of water. So for this primary dilution, I would need 19 ounces of 20 index chemical in 109 ounces of water to make 1 gallon of 3 index solution. So that's technically what the answer would be. 19 ounces of 20 index chemical in 109 ounces of water to give a 3 index 1 gallon solution. So again, the answers usually are 19 ounces of fluid in 109 ounces of water. That's what the answers will look like on the test. Now, one thing on a test don't do is don't add 19 and 109 and go, okay, it's 128, that must be the answer. All the answers are going to equal 128, so make sure you do the actual calculation. Another type of dilution you might have would be multiple chemicals. So multiple chemicals that have an index. Now, we've seen this equation before. It's C1 times V1 plus another C1 and V1. I put C1A and V1A just to kind of separate the chemicals. And then the dilution in the tank, right? There will only ever be one C2 and one V2, but I can have multiple C1s and V1s. This is used if I'm using 2 arterial fluids at the same time, which I recommend you don't do. There's no need for that. Or I'm using an arterial fluid and a co-injection that have an index. So an example of this would be, what is the index of a 1 gallon solution made up of 16 ounces of a 2 index fluid and 32 ounces of a 25 index fluid? So again, we look at our equation and we plug the numbers in. Now, whichever C1 and V1 you want to use doesn't matter, just make sure they coincide. So for instance, C1 on the left would be 2, that's the 2 index fluid, 16 ounces of that. The C1A would be 25, and I'm using 32 ounces of that. Okay. So I would have 32, which is 2 times 16, and 800, which is 25 times 32. Okay, so 32 plus 800 divided by 128, and I'll get X, right? So X is 6.5. That's how you do those multiple chemicals. And again, I can have 3 or 4, possibly. All you got to do is keep adding a C1 and V1. Now, this particular problem is kind of an example of what you'll run into in practicum sometimes. So practicum, they rarely are calculating out of their indexes. They should be, but they don't. So they might just start throwing 2 arterial fluids into a tank. Well, you need to figure out what the index of that solution is going to be. And this equation is how you would do that. So the recommended quantity of arterial solution, we've all remember this, it is 1 gallon per 50 pounds of body weight. And now you're not necessarily going to know exact body weight, but make a pretty good estimate. The temperature of the arterial solution or arterial fluid is recommended that it's mixed with room temp water pretty much all the time. We don't want it too cold because that slows down the reaction and leads to swelling. We don't necessarily want it hot unless we're dealing with a difficult case. So for instance, tissue gas or edema or advanced decomp. Those you can go with a little bit higher temperature water, but for normal cases or dehydrated cases, you want room temp water. So now we're going to look at pre-injection fluids. Again, pre-injection fluids are injected into the body before you inject your arterial fluids, your arterial solution. They are also called primary injection fluids, or sometimes a capillary wash fluid. The idea is that it's going to get the body ready for the arterial solution, but also help to push out blood from the capillaries. That's why they call it a capillary wash fluid sometimes. Again, important to know those different names because they don't always put pre-injection fluid on the bottle. They may call it something else. Pre-injection fluids are designed to help clear out intravascular blood discolorations, so like things like livor mortis, help adjust the body pH because most of them have buffers, and help to reduce blood coagulation because they have anticoagulants. Now, some pre-injection fluids may also have some hemolysins, things that break up clots in the capillaries. The recommended amount of a pre-injection fluid is 1/2 to 1 gallon, and you tend to inject it under closed drainage. Now, this can be a problem. Injecting anything under closed drainage means that there's no drainage coming out. You either haven't opened the vein yet, or you've opened the vein but you've clamped it off or had a drain tube closed. The idea behind this is it's going to help push blood across the capillaries, or at least give a lot of force for that. Problem with injecting things under closed drainage is that it could lead to swelling, so you have to be kind of careful with that. You should let it sit for about 20 to 30 minutes to let it do its work. And their recommended use is only on bodies that do not have any arterial circulation problems. And to me, this is a problem because most of the bodies that we're going to embalm have arterial circulation problems, by and large. Sclerosis, things along those lines. So pre-injection fluids I'm not a fan of. I never used them. I know some people who sing their praises, but I've never found them to be very useful. Not only can it lead to swelling because I'm doing it under closed drainage, if the body does have arterial problems, I could blow out an artery. So now it's going to affect my distribution. But not only that, I've just pumped in 1/2 gallon to 1 gallon of extra water, basically, and that's going to lead to higher secondary dilution. So I'm not a fan of pre-injection fluids. The effects of co-injection fluid is that it's going to
hopefully help facilitate our distribution and diffusion. It's going to help us get arterial solution through the arterial system to the capillaries, and then once it's in the capillaries, to get past the walls of the capillaries. Should also help to control and enhance the arterial fluid. So to help the arterial fluid do its job, if you will. Recommended amount depends on the co-injection fluid. Some co-injection fluids actually have directions on how to use them. The general rule of thumb is it's an equal amount or half the amount of the concentrated arterial fluid used. So if you have, let's say, 32 ounces of arterial fluid that you used, then you should use at least 16 ounces, maybe 32 ounces of the co-injection. Again, depending on the co-injection, it might actually have directions on how to use it, so look for those. They tend to be on the bottle. We can use most of these almost in every embalming. About the only co-injection that you wouldn't use for every embalming would be humectants. Those are the only ones that are only for special cases. Pretty much every other type can be used in every embalming. We can also use certain co-injection fluids as the vehicle for waterless embalming. Now, waterless embalming is something that's done only in really extreme cases. And the kind of the definition of waterless embalming is injection with embalming fluid undiluted with extra water. So we wouldn't add water to the tank, but we might not necessarily want to embalm the body with just straight fluid. So for instance, I have a floater. I might want to have a really high index. So, maybe a 20 or something like that. But I want to use a 30 index fluid to do that. Well, instead of adding water, I would just add the same amount of co-injection as I would have of water. So the co-injection becomes the vehicle. I do this for jaundice bodies because I want to have a lot of buffers in there. And so I will, instead of using water, inject or mix the arterial fluid with co-injection that has a lot of buffers in it.
When we talk dyes, there are two types, which we've seen before. There are inactive dyes, which only color fluids, not tissue. Inactive dyes are oftentimes used in cavity fluids because it helps you to recognize cavity fluids without having to look at the names of the cavity fluids. Or active dyes. These will color the tissues and the cells. Active dyes are often found in arterial fluids or as a co-injection. The effects of dyes, why we use them, one is to hopefully restore natural color. That's why we kind of want to use reddish dyes because we're trying to reinstate the red color from blood. That's kind of dependent upon really good diffusion and distribution. They act as a tracer for distribution and diffusion, more for distribution technically, because if I see dye in the toe, then I know it's getting distribution there. Diffusion, it can be used as a marker for diffusion, but only when it kind of suffuses the entire area. So just the appearance of dye is not good diffusion. So let's say I talk the big toe. I start to see dye in the big toe, that's distribution. When the entire big toe is the color of the dye, that's more of an indicator of diffusion. Dyes can also help mask the darkening from formaldehyde gray. Again, hopefully we're getting good drainage, and the formaldehyde gray, if it shows up at all, is only going to show up on the back of the body because the blood has gravitated out of the viewable areas, but dyes can help to cover that. Again, the use of them, the recommended use is that it can be added to the entire volume of the arterial fluid, which I would suggest. Adding it to the entire volume of the arterial solution helps you to use it as a tracer for distribution. That's one of the main things for dyes. You could also do it to last gallon used. Again, the idea behind that is that it will go into and stay in the body more and maybe even up into the head more. I'm not a fan of that. I don't see any use in doing that, but it is a standard practice, we'll put it that way. Next, we're going to look at humectants. Humectants, again, are used to help tissues retain moisture, so keep the tissues moist and pliable. Especially used on dehydrated bodies and babies. Keeping babies pliable is very important. I use humectants on normal cases. I also use humectants oftentimes, depending on the condition of the body, on autopsy bodies because they've exsanguinated, they've lost all their fluids, and so their tissue that is remaining tends to be a little bit more dehydrated. Humectants can also help to protect tissue from the harsh reactions of formaldehyde, especially in dehydrated bodies. This can help to avoid walling off in a dehydrated body. How to use humectants? Again, sometimes people will add them to the last gallon of the solution. I'm not a fan of that. The idea is that, again, it would stay in the body more so. I don't buy that, but again, it is an accepted standard practice. It's just not one I agree with. On normal cases, they suggest when using humectants that you use intermittent drainage. Again, intermittent drainage is when I continuously inject and only cut off the drainage every once in a while. That helps to build resistance in the venous system. So what that's going to do is help keep the humectant in the capillaries longer. Humectants tend to be a little bit bigger molecules, and so they might take a little bit longer to diffuse. One of the things you have to be careful with intermittent drainage is that you avoid swelling, so you always want to kind of keep an eye out for that. On dehydrated bodies, they suggest you use closed drainage, or what we would call alternate drainage. Alternate drainage, it means that I keep the drainage closed and I inject about a quarter to a half a gallon, roughly, a quart or two, and then I stop my injection, I open the drainage and let it drain. Once the drainage slows down or stops, I close the drainage and I inject again. And so you never inject and drain at the same time. The idea behind this is that it will, again, help keep the humectants in the capillaries longer, helps them diffuse, but it could also help to elevate facial tissue to normal levels. And this is true, but one of the problems with using closed drainage in this way is that it can lead to swelling, and just like intermittent drainage. So you have to be really mindful of that. Now, we haven't looked at cavity fluids really yet, at least not for the uses of it. We'll talk more about cavity fluids next semester in embalming, but the use of cavity fluids is to treat abdominal and thoracic cavities in cavity embalming. The idea with cavity fluids mainly is the use of this as a disinfectant. We don't use cavity fluids to firm up and preserve the organs of the thoracic and abdominal cavity. Your arterial injection should have done that. What its real main use is to inactivate any bacteria found in the hollow viscera and in the spaces in between the organs. Because if that bacteria is not killed, it's going to create gas, and that will lead to purge. We also use cavity fluids to treat the viscera removed in an autopsy. We'll talk about that next semester, but you basically pour cavity fluid on top of that viscera and let it sit while you embalm. We can also use it for surface embalming in surface compresses. The recommended amount of cavity fluid for cavity embalming is 32 ounces minimum. 16 bottles up, or 16 ounces up, 16 ounces down. So 1 bottle up, 1 bottle down. 16 ounces in the thoracic cavity, 16 ounces in the abdominal cavity, minimum. And that's for dehydrated bodies, normal bodies, doesn't matter. Certain bodies might need more. Obese people tend to need more. Bodies that are decomposing tend to need more. Edematous bodies tend to need more because they're going to be more prone to bacterial activity, gas formation, and then purge. And that's really what cavity fluid's designed to do, is stop purge. Now, kind of similar to cavity fluids are preservative gels. Most of the time, or at least the early version of preservative gels, were cavity fluids that were suspended in gel form. Nowadays, they have that version, but they also have versions of phenol being suspended in gel form. So depending on what you're trying to do might determine which type of gel you use. They come in semi-liquid or gel form. Most of them are gels. The semi-liquids are more for cavity or for surface compresses, not so much just to paint on. They are osmotic surface embalming chemicals, meaning that they will penetrate. They oftentimes have surfactants in them, and so the idea is that it's going to penetrate into the surrounding tissues. They are very good at surface embalming. I love to surface embalm with gels. They do take time to work, so if you're in a hurry, gels aren't necessarily the best thing to use, but they work really well over time. You can also use them to help eliminate the odors of pathological conditions, such as gangrene. You paint that on gangrene, it will help to get rid of some of that smell. So depending on what kind of gel you're using, they can either be poured onto cotton for a compress. Most of the time we brush them on. Again, don't use the same brush to paint on gel as you would to paint on, let's say, massage cream. Have its own brush for it. You want to leave it on for several hours, as long as you possibly can. That's the best way to use them. When you do use the gels, you want to use them in a well-ventilated area. They will fume quite a bit, but to help cover that fuming and protect yourself from that fuming, you should always cover it with plastic. I use shrink wrap. I always had a big roll of shrink wrap in my prep room, and smaller rolls like you would use to bind a package with of shrink wrap. Shrink wrap works great. You cover it with the plastic, it retains the fumes, so you're not getting exposed, and also the gel doesn't dry out as quickly, so it has longer time to work. So anytime you do any kind of surface embalming, you really want to cover that with plastic. And last up are the jaundice fluids. The idea behind a jaundice fluid is it's designed to either hide or get rid of the yellow discoloration. So sometimes they're dyed or sometimes they're bleaching jaundice fluids. They tend not to be the greatest of preservatives. It depends. There are some nowadays that are a little bit better than others. But for a long time, jaundice fluids were very low index because, again, they thought it was formaldehyde interacting with bilirubin that was changing yellow to green. We know that's not the case. It's formaldehyde interacting with proteins that creates an acidic environment that changes yellow jaundice to green jaundice. And so you want to be careful that you don't under-embalm a jaundice body. Preservation is more important than coloration. If you use less formaldehyde because you're worried about turning yellow jaundice green, you're going to under-embalm the body, and the body's going to turn green anyway because you've under-embalmed it. So make sure it's well preserved. Also remember that jaundice is caused by bilirubin. Bilirubin has nitrogenous components to it, so it will neutralize formaldehyde. So don't under-embalm jaundice bodies. It's very easy to do. Jaundice fluids don't tend to be very good on deep jaundice discoloration. A lot of these fluids are flushing fluids. Flushing fluids only get rid of intravascular discoloration, not extravascular discolorations like jaundice. And they suggest that you do not use jaundice fluids with other types of arterial fluids or pre-injection fluids unless the manufacturer says it's okay. Because jaundice fluids are kind of specially formulated, and if you start throwing other things in, it can throw off what that jaundice fluid is supposed to do. Okay, so that finishes it up for thanatochemistry. We're going to have a test next week, or we'll schedule a test number 3 for this before the final, and then we will review for the final.